The night shift at Metropolitan General Hospital had turned the ICU into a battlefield of a different kind. Wealthy families demanded answers that medicine couldn't provide. Machines beeped with the rhythm of borrowed time, and death stalked the corridors with the patience of an apex predator. Everyone was fighting their own war against mortality. Everyone except the quiet man in navy scrubs who moved through the chaos like he'd seen worse battles in places where the enemy shot back. They saw a humble hospital orderly, someone who cleaned rooms and transported patients. They had no idea they were dismissing one of the Army's most decorated battlefield medics. Daniel Rodriguez, 40 years old, walked the halls of Metro General with the steady calm of someone who had learned to find peace in the eye of storms. His graying temples and kind brown eyes made him look exactly like what he appeared to be, a hospital orderly content to work in the background while others made the life and death decisions. His navy blue scrubs were always perfectly pressed, his movements efficient and respectful, his presence so understated that most people forgot he was there. Hidden beneath his humble uniform, faded scars told stories of IED explosions and firefights, while the combat medical badge tattooed over his heart marked him as someone who had saved lives when seconds mattered more than protocols. Metro General was supposed to be his refuge from war, a place where he could serve without the weight of command. But tonight, when death came calling for a patient whose family thought money could rewrite medical reality, Daniel would discover that some battles choose you regardless of the uniform you wear. For more powerful videos about our military heroes, please take a moment to subscribe to the channel. Your support helps us continue to tell these important stories. If something like this has happened to you, share your story in the comments below. Daniel Rodriguez, 40 years old, moved through the corridors of Metropolitan General Hospital with the quiet efficiency of someone who had learned to navigate chaos without creating more of it. His navy blue scrubs were perfectly pressed, his ID badge hung straight, and his black work shoes made no sound on the polished linoleum floors. At 6 feet tall with graying temples and kind brown eyes, he looked exactly like what he was supposed to be, a hospital orderly, someone who cleaned rooms, transported patients and stayed in the background while the real medical professionals did their work. But looks, as Daniel knew better than most, could be devastatingly deceiving. The night shift at Metro General was supposed to be quieter than the day rotation. But quiet in a level 1 trauma center was relative. Daniel had been working these halls for 8 years now, ever since his medical discharge from the Army, and he'd learned to read the subtle signs that separated a normal night from one that would test everyone's limits. Tonight felt different. The emergency room had a tension that reminded him of forward operating bases just before major operations. Nurses moved with purpose, residents looked anxious, and the charge nurse kept checking her watch. Daniel had seen this kind of anticipation before, in places where getting ready meant the difference between life and death. His job description was simple: transport patients, restock supplies, maintain equipment, and assist wherever needed. What the job description didn't mention was that wherever needed sometimes meant places where his particular set of skills became invaluable. The other orderlies saw him as the guy who could lift anything, fix anything, and somehow always knew exactly what was needed before anyone asked. They had no idea that his precision came from years of field medicine, that his calm demeanor was forged in combat zones, or that his ability to anticipate medical needs came from saving lives when seconds mattered more than protocols. The elevator chimed softly as Daniel reached the ICU on the 7th floor, pushing a cart full of fresh linens and supplies. The intensive care unit was where the most critical patients fought their battles against death, and it was where families faced the hardest moments of their lives. Daniel had learned to move through these rooms like a ghost, providing what was needed while respecting the sacred space between the living and those fighting to stay that way. Room 714 was different tonight. Through the glass partition, Daniel could see a crowd of well-dressed people gathered around the bed, their designer clothes and expensive accessories marking them as the kind of family that expected to control everything, including things that couldn't be controlled. The patient was Richard Blackwood, 67, a real estate mogul who'd suffered a massive heart attack during a board meeting. His family had descended on the hospital like a corporate takeover, demanding answers, demanding action, demanding that someone be held accountable for the fact that their patriarch was dying despite their wealth and influence. Chapter 2: Privilege Meets Reality. Dr. Sarah Chen, the attending physician, emerged from room 7114 looking exhausted. At 38, she was one of the youngest department heads in the hospital's history, but tonight she looked like she'd aged a decade in the past few hours. "How bad is it?" Daniel asked quietly, the way he'd learned to communicate with medical staff who appreciated directness over small talk. "Bad," Dr. Chen replied, unconsciously running her hands through her hair. "Massive MI, complications from emergency surgery, and a family that thinks money can rewrite medical textbooks. They're demanding treatments that don't exist and blaming everyone for not performing miracles. Daniel nodded, understanding the weight of what she wasn't saying. The Blackwood family's reputation preceded them. They were the kind of people who donated wings to hospitals and expected that generosity to translate into special treatment for their loved ones. The kind who saw medical staff as employees rather than professionals. "Need anything?" Daniel asked. "Patience," Dr. Chen said with a tired smile, "and maybe a miracle." As if summoned by her words, an alarm began blaring from room 7H14. The steady beep of the heart monitor had been replaced by the flat, continuous tone that every medical professional dreaded. The patient was coding. Daniel moved immediately, his body responding with the automatic precision of someone who'd heard that sound too many times in too many dangerous places. He was through the door of room 714 before the code blue announcement finished echoing through the hospital. The scene inside was chaos. Richard Blackwood lay motionless on the bed, surrounded by machines that had been keeping him alive. The heart monitor showed the dreaded flat line, and Dr. Chen was already moving toward the crash cart, calling out orders to the nurses who were rushing into the room. But between Daniel and the patient stood the Blackwood family, and they were not moving. "What's happening?" demanded Margaret Blackwood, Richard's wife, her voice sharp with panic and authority. "Why isn't someone doing something?" "Ma'am, we need you to step back," Dr. Chen said firmly, trying to position herself to begin resuscitation. "We need room to work." "Don't tell me to step back." Margaret's voice rose to a near shriek. "I want to know what you people have done to my husband." Her son, Richard Jr., stepped forward, his face red with anger and grief. "This is unacceptable. We want another doctor. We want the department head. We want to save your father's life," Daniel said quietly, moving toward the bed with the calm authority of someone accustomed to crisis situations. "Please move away from the bed." Richard Jr. turned on him with fury. "Who the hell are you? You're not even a real medical professional." Daniel continued moving toward the patient, his hands already reaching for the manual resuscitation equipment. In his mind, he was calculating time, measuring the seconds since the heart had stopped, preparing for the systematic approach that had saved lives in field hospitals from Kandahar to Mosul. "Sir, I need you to step aside," Daniel said, his voice carrying the kind of authority that had commanded respect in combat zones. "You're not qualified," Margaret screamed, pushing against Daniel's chest. "You're just an orderly. Get away from my husband." When Daniel didn't stop moving toward the patient, Richard Jr. grabbed the front of his scrubs and yanked with all his strength, trying to physically force him away from the bed. The fabric tore with a sound like thunder. Chapter 3, The Truth Revealed. The silence that followed was absolute and profound. The torn scrubs had revealed something that made every person in room 7114 freeze in place, their breath caught in their throats. Tattooed across Daniel's chest in perfect detail was the Combat Medical Badge of the United States Army, the distinctive red cross surrounded by a wreath, marking him as someone who had provided medical care under enemy fire. Below it, carved into his skin by shrapnel and surgical scars, was a map of trauma that spoke of battlefield medicine practiced in the world's most dangerous places. Hanging from a simple chain around his neck were ribbons and medals that told a story most civilians would never fully understand. The Bronze Star with V device for valor, the Purple Heart for wounds received in action, and the Army Commendation Medal with Combat Medical Badge device. Dr. Chen stopped moving toward the crash cart, her eyes wide with recognition. The nurses who had been preparing to begin resuscitation stood frozen, staring at evidence of medical training that went far beyond anything they'd imagined. "Staff Sergeant Daniel Rodriguez," Dr. Chen whispered, pieces of a puzzle suddenly falling into place. 68 Whiskey, combat medic. I read about you in the medical journals." Daniel didn't pause for recognition or explanation. While everyone else was processing what they just learned, he was already moving with the systematic precision of someone who'd performed this exact procedure dozens of times when lives hung in the balance, and there was no room for error. "Time is critical," he said, his voice carrying the calm authority of a battlefield medic. "Dr. Chen, I need you to intubate. Nurse Williams, prepare epinephrine. We need to establish rhythm and get circulation back." His hands moved across Richard Blackwood's chest with the confidence of someone who'd performed CPR on dying soldiers while mortar rounds fell around them. Each compression was precisely placed, timed to the second, delivered with exactly the right amount of pressure to pump blood through a heart that had stopped beating. The Blackwood family stood frozen, watching the man they dismissed as just an orderly take command of the most critical moment of their father's life. Chapter 4, Command and Control. Who are you?" Margaret Blackwood whispered, her voice barely audible over the sounds of emergency medical procedures. Daniel continued chest compressions, his count steady and sure. 37, 38, 39. He looked up at Dr. Chen, who was preparing to intubate. Staff Sergeant Daniel Rodriguez, retired. 68 Whiskey Combat Medic, 10th Mountain Division. Served 3 tours in Afghanistan, specialized in forward trauma care. Richard Jr. sank into a chair, his face pale with the realization of what he'd just done. We didn't know. Check pulse, Daniel called out, briefly pausing compressions to allow Dr. Chen to assess the patient. No pulse, continuing CPR. Dr. Chen, how's that intubation coming? Almost there, Dr. Chen replied, her own training taking over despite her shock. Tubes in, we have airway. Daniel resumed compressions, his rhythm never faltering. Nurse Williams, push 1 milligram epi. Let's see if we can get this heart talking to us again. Margaret Blackwood found her voice again, but now it carried a different tone entirely. You're a combat medic, Daniel replied, not breaking his rhythm. Not a doctor, but trained in trauma medicine, battlefield surgery, and emergency procedures. I've done this exact procedure under rocket fire in places where the nearest hospital was a helicopter ride away. The heart monitor gave a single blip, then another. Daniel felt for a pulse, found one weak but present, and stepped back slightly. We've got rhythm, he announced. Weak but steady. Dr. Chen, let's get him on a continuous drip and monitor for the next 10 minutes. As the immediate crisis passed, the room began to breathe again. But the atmosphere had changed completely. The Blackwood family looked at Daniel with a mixture of awe, shame, and growing understanding of what had just happened. Chapter 5, The Reckoning. Dr. Chen stepped back from the patient, pulling off her gloves with shaking hands. Daniel was checking Richard Blackwood's vitals, his hands moving with the practiced efficiency of someone who'd monitored countless patients in far worse conditions. Forward Operating Base Phoenix, Afghanistan. We were running trauma calls 3 times a week, sometimes with incoming fire, sometimes with medical supplies that had been improvised from whatever we could find. Margaret Blackwood approached slowly, her designer heels clicking softly on the hospital floor. Mr. Rodriguez, I owe you an apology. We all do. Ma'am, your husband is stabilized but still critical. The next few hours will tell us a lot about his prognosis. Richard Jr. stood up, his face still flushed with embarrassment. Why are you working as an orderly? With your training, your experience, couldn't you be a paramedic or a nurse or… Daniel finished checking the patient's IV line before answering. PTSD, he said simply. After 3 tours, I needed something quieter. Something where I could still help people but without the pressure of being in charge of life and death decisions every day. Dr. Chen shook her head in amazement. But you just took charge of the most critical code we've had all month. You coordinated our entire response. Old habits, Daniel replied. When someone's dying, training takes over. But most of the time, I prefer to work in the background, support the medical staff, make sure everything runs smoothly. Margaret sat down heavily in the chair beside her husband's bed. We judged you. We dismissed you. We treated you like you. Ma'am, people make assumptions. It's human nature. What matters is what happens next. Chapter 6, Recognition. Over the next hour, word spread through Metropolitan General like wildfire. The story of the orderly who was actually a decorated combat medic reached every department, every floor, every break room in the hospital. Dr. Martinez, the emergency department chief, arrived within 30 minutes. Behind him came 2 other physicians Daniel recognized but had never formally met, and a woman in a sharp business suit who introduced herself as the hospital's chief administrator. Staff Sergeant Rodriguez, Dr. Martinez said, extending his hand, I'm embarrassed that we didn't know about your background. Your personnel file lists your military service, but not your specific training or decorations. Daniel shook his hand. I prefer to keep my service private, sir. It's not relevant to my current job. Not relevant? The administrator stepped forward. You just saved a man's life using skills that most of our residents don't possess. You coordinated a code blue response that was, according to Dr. Chen, flawless under extreme pressure. Dr. Chen nodded. I've been practicing medicine for 15 years, and I've never seen anyone take command of an emergency situation like that. The calm, the precision, the way you anticipated every need before I could ask for it. That's combat medicine training, Daniel explained. When you're working in a field hospital with incoming mortars, you learn to think 3 steps ahead, to coordinate with your team without wasting words, to stay calm when everything around you is falling apart. Richard Jr., who had been listening quietly, stepped forward. Mr. Rodriguez, I want to apologize again. Not just for grabbing your shirt, but for assuming that your job title defined your worth as a person. Daniel looked at him with the same steady gaze he'd given countless frightened soldiers. Son, your father was dying. People say and do things they don't mean when they're scared. What matters is learning from it. Margaret Blackwood, who had been holding her husband's hand while he slept, looked up with tears in her eyes. How many people have you saved? In Afghanistan, I mean. Daniel was quiet for a moment, considering how to answer. More than I can count, but also fewer than I wanted to. Chapter 7. The Offer. Dr. Martinez cleared his throat. Staff Sergeant Rodriguez, I want to make you an offer. Our emergency department could use someone with your experience. We could fast-track your EMT certification, get you into a paramedic program, have you working as medical staff within 6 months. Daniel shook his head. I appreciate the offer, sir, but I like what I do. I like being able to help without having the weight of command. Most days I transport patients, I restock supplies, I make sure the medical staff has what they need. It's peaceful work. But tonight, Dr. Chen began. Tonight was different. Tonight someone needed the skills I learned in the Army. But most nights, what people need is someone who can listen, who can bring them a warm blanket, who can explain where the bathroom is. There's honor in that kind of service too. The administrator looked puzzled. But surely you want to advance, to use your medical training more fully? Daniel smiled, the first genuine smile anyone had seen from him all evening. Ma'am, I've been in situations where I had to perform surgery with bullets flying overhead, where I had to decide which wounded soldier to treat first when there were more casualties than I could handle. I've carried dying men to helicopters while calling in airstrikes on the people shooting at us. He gestured around the quiet ICU room. This is exactly the pace I want. Most days I can help people heal in peace, and on nights like tonight, when someone needs a combat medic, those skills are still there. Chapter 8. New Understanding. Over the following weeks, something changed at Metropolitan General Hospital. Daniel continued working as an orderly, but his relationship with the medical staff evolved. Residents started asking him questions about trauma care. Nurses sought his advice on difficult procedures. Dr. Chen began consulting with him on emergency protocols. The Blackwood family visited regularly as Richard Sr. recovered from his surgery. Margaret brought Daniel homemade cookies and always asked about his well-being. Richard Jr. started a scholarship fund for military veterans pursuing medical careers, naming it the Hidden Heroes Scholarship in honor of all the people whose true qualifications are hidden behind humble job titles. But perhaps the most significant change was in the way the entire hospital staff began to see their colleagues. The story of the decorated combat medic working as an orderly made everyone wonder who else might be carrying skills and experience that went far beyond their job descriptions. The answer, as it turned out, was almost everyone. The elderly lady who cleaned rooms on the 3rd floor had been a nurse in Vietnam. The security guard who worked weekends had been an Army MP. The cafeteria worker who always knew exactly what everyone needed had managed logistics for a major corporation before retirement. Daniel's story became a reminder that heroism doesn't always wear the uniform people expect, that expertise doesn't always come with the title people assume, and that the person cleaning your room, serving your food, or transporting your loved one might be someone whose life experience could fill books. Chapter 9. The Real Medicine. 6 months after the incident in room 714, Daniel was restocking supplies on the pediatric ward when he encountered a young soldier, barely 20 years old, who'd been brought in after a training accident at the nearby military base. The soldier was awake but clearly in pain, and more importantly, clearly terrified. His eyes held the same look Daniel had seen in too many young faces, the fear of someone who'd signed up to serve but hadn't expected to face his own mortality so soon. "How you doing, soldier?" Daniel asked, checking the chart at the foot of the bed. "Been better, sir?" the young man replied automatically, then caught himself. "Sorry, you're not military, are you?" Daniel smiled, the same calm smile that had reassured countless frightened people over the years. "Staff Sergeant Rodriguez, retired, 10th Mountain Division. What's your unit, son?" The relief in the soldier's eyes was immediate and profound. "1st Infantry, sir. This is my first deployment prep, and I was scared I'd never get to serve." "What's the diagnosis?" Daniel asked. "Broken ribs, punctured lung, some internal bleeding. They say I'll be fine, but the injury might affect my deployment status." Daniel sat down in the chair beside the bed, settling in for what he recognized would be an important conversation. "Let me tell you something about service, soldier. I spent 3 tours in Afghanistan, saved more lives than I can count, got medals for valor, and got wounded twice. You know what the most important thing I learned was?" The young soldier shook his head. Service isn't just about carrying a rifle or wearing a uniform. Service is about being the person others can count on, whether that's on a battlefield or in a hospital room, whether you're wearing ACUs or scrubs. Daniel gestured around the pediatric ward. Every day I serve people who need help. Sometimes it's bringing them blankets, sometimes it's holding their hand while they're scared, and sometimes it's using my medical training to save their lives. The soldier was listening intently now. If your injuries prevent you from deploying, that doesn't make you less of a soldier. It means you'll find a different way to serve. The military taught you skills, discipline, and values that will serve you no matter what job you end up doing. The question isn't whether you'll get to carry a rifle. The question is, how will you use what the Army taught you to make the world a better place? As Daniel spoke, he realized he was describing his own journey, his own path from the battlefield to the hospital, from combat medic to orderly, from someone who saved lives with advanced trauma techniques to someone who saved lives with compassion, patience, and quiet expertise. Epilogue, hidden in plain sight. 2 years after the night in room 714, Daniel Rodriguez still worked the night shift at Metropolitan General Hospital. He still wore navy blue scrubs, still transported patients, still restocked supplies, but now everyone knew who he really was. The difference was that knowing his background hadn't changed his job. It had changed how people saw all the jobs around them. The hospital had become a place where people looked deeper, asked questions, and recognized that extraordinary people often chose ordinary-looking ways to serve others. Richard Blackwood Sr. made a full recovery and returned to running his real estate empire, but he also started a foundation that provided job training and placement services for military veterans, with a special focus on helping them find positions where their skills could be used, regardless of the job title. Margaret Blackwood became a volunteer at the hospital, spending her time talking with families during medical emergencies, helping them understand that the people caring for their loved ones were often more qualified and dedicated than anyone could guess from their uniforms or name tags. And Daniel continued doing what he'd always done, being exactly where he needed to be, with exactly the skills that were required, helping people in ways both small and profound. The only difference was that now, when medical emergencies arose, nobody questioned his right to step forward and take command. But most nights, he preferred it the other way. Most nights, he was content to be the quiet man in scrubs who made sure everyone had what they needed, who listened when people were afraid, who brought comfort in the small hours when darkness made every worry seem larger. Because he'd learned, in places where life and death decisions came down to seconds, that the most important service isn't always the most visible service. Sometimes the greatest honor comes not from being recognized as a hero, but from being trusted to do whatever needs doing whenever it needs to be done. The medals were nice, but the real reward was in the work itself. Before you go, I want to hear from you. Have you ever discovered that someone you underestimated had incredible hidden talents or experience? Have you ever been judged by your job title rather than your actual abilities? Share your story in the comments below. Your experience might help someone else recognize the hidden heroes in their own life. And if this story reminded you to look beyond the surface, to recognize that extraordinary people often choose humble ways to serve others, hit that subscribe button, because heroes work among us every day, in every profession, and everyone deserves to have their story told.